Turning now to our health news today and the shingles vaccine, which can do more than just prevent that painful rash of shingles. It can also decrease the incidence of heart attacks and strokes, all according to a study published recently in the European Heart Journal. Joining us now is our medical expert, Dr. David Winter from Baylor Scott & White Health. And Dr. Winter, you've seen this new study. What do you make of it?
Well, it's a very impressive study following 1 million adults over 8 years. And what they found is that folks who had the Zostavax shingles vaccine had a 23% less chance of heart attacks and strokes than those who didn't. Now, that vaccine treats shingles, which is the varicella zoster virus, the same one that causes chickenpox. And the thought is that chickenpox, when you get it as a child, stays in your body quietly for decades, then pops out as shingles. It may also be affecting adversely your heart and your blood vessels, Mark.
Well, it's interesting because usually you take a vaccine to prevent yourself from getting, an infection of some sort, but you've got a virus here that stays in your body for decades and then leads to heart attacks and strokes. You're taking the vaccine maybe even after you've already gotten it to prevent the later effects, correct?
That's right, and how it could do that is interesting because we know there are a lot of risk factors for heart attacks and strokes. There's diabetes, high cholesterol, there's smoking, that can do it. So what's this with a virus? Well, it causes inflammation. We think that chronic inflammation can also increase the chance of heart attacks and strokes, and that's what the virus seems to be doing.
You mentioned the Zostavax vaccine, the one that this recent report studied. Is that the one that we use here in the States?
It used to be, Mark. We don't use it anymore because it tended to wear off through the years, and the new one, Shingrix, lasts a much longer period of time. It's much more effective. So we think also it should be more effective against the inflammation that can lead to heart attacks and strokes.
Certainly interesting for the layperson to find out that you've got a virus here that's responsible for more than just infections and rashes like shingles. You may have some other effects as well. Yeah, these viruses, they're pretty nasty critters. They're implicated in cancer. The hepatitis C virus leads to cancer of the liver. Human papillomavirus, HPV, leads to cancer of the cervix. We also know that when you get COVID in the brain fog, well, that's probably the COVID virus in your brain. And just last month, we found out that the shingles virus can also probably cause some forms of dementia. So viruses do a lot of things, and it looks like the vaccines that we get are much more effective than just treating the infection. So this is a hurrah for vaccines, Mark. All right, well, maybe some promising research in this study. Dr. David Winter, thank you as always for joining us.
Thank you, Mark. Good to be with you.